Good afternoon. It's a lovely afternoon. Welcome to another exciting episode of the Real Talk Show. You guys know that here we have real conversations, sometimes uncomfortable, but real conversations. And today we're unpacking a topic that affects a lot of us, especially young people, when it comes to accessing health services at our health facilities. Today we are discussing about consent law, age of consent, our rights, your rights, and what it means accessing sexual reproductive health rights. Here is a situation. You are a 16-year-old, you want to test for HIV. You go to a facility and they tell you are underage and you're supposed to come with your parents or rather your guardians. What do you do in this situation? Do you go back? Do you stay silent? Or do you ask someone who's not your parent to escort you because then you don't know the outcome? Today, ladies and gentlemen, our lovely viewers, we are talking about the consent laws, rights, and their impact when it comes to accessing sexual reproductive health rights. And today, I'm joined by two amazing guests. The first one is Brian Mwanza. This one is my namesake. Hi, Brian. Welcome to the show.
Thank you very much, Brian, and I'm happy to be here, my fellow namesake.
Yeah, thank you so much, Brian. And I have Foster Mafaila. I hope I pronounced your name well. And Foster is a sexual reproductive health right officer and youth advisory panel member. Equally, Brian is a regional sexual reproductive health fund. Uh, Yes, that's that. And to us, to our viewers, I have Shadrach Chansa, who is our sign language interpreter. You always know that here at the Youth Platform 360, we believe that it's inclusive and we have to provide a sign language interpreter for our brothers who are living with disabilities. To kickstart the conversation, I would first love to start with you, Foster. Foster, what do you understand by age of consent laws?
All right, thank you so much, Brian. It feels good to be sharing this kind of information on this platform. My name is Foster Mafiala, and I work with SRH Africa Trusts, SAT Malawi. I'm also a youth advisory panel member for HIVOS under the SRHR Regional Fund. So, to answer your question, Brian, basically, age of consent actually refers to the minimum age at which a person is legally considered able to agree to sexual activity. So, what I'm trying to say here is each and every country has a legal set of framework. It can be laws, acts that are put in place where they define age for a person to give consent to sexual activity or accessing sexual reproductive health and rights services, or as well as even marriage. So, actually, in a legal context, to give what is age of consent, I can say it's that. In Malawi, we have. I'm from Malawi, by the way. I'm just your neighbor, Achimwene. So I'll pretty much be talking about the context from which I'm coming from. Of course, I'll also refer to Zambia. But for Malawi, when it comes to age of consent, for one, it defines a child as anyone who is below the age of 18. That means you cannot get married if you're under the age of 18. That is according to the Constitution of Malawi. At the same time, we also have the Gender Equality Act. The Gender Equality Act is where it defines that anyone who is sexually active or anyone can go and access sexual reproductive health and rights services. There are other countries that sets age or minimum limit around that when you want to go and access services. For example, I know Zambia has, I think if it's not 16, that one has to, for you to go and access sexual reproductive health and rights services, you need to have a guardian or a parent to go and access such services. So, I mean, in Malawi, as I've said, currently we're struggling. We have made progress, not struggling really, but we have made progress when it comes to accessing sexual, when it comes to age of consent around issues of SRH services. But it's great to know that in our context is different. Zambia might be experiencing different aspects of age of consent, Zimbabwe as well, even if you look at Kenya, if you look at South Africa. So, in a nutshell, basically, age of consent is where they set a minimum age for one to go and access sexual reproductive health and rights services or even marriage when it comes to that. So, to keep it short, that's what I can say when it comes to age of consent. Thank you.
Thank you so much, Foster, for explaining to us what age of consent really means, especially to young people when it comes to accessing health services. And I would also love to find out from you, Brian, what happens when young people, or rather a young person, is sexually active and is legally restricted from accessing health services.
Okay, thank you very much for that question, Brian. And I must say, that's the whole reason why we have such kind of conversations. It's because, by law, there are some restrictions when it comes to young people accessing these services, whereas the reality is a lot of young people are actually sexually active, and the danger comes in where a person who is sexually active and denied a particular service. The danger comes in where young people are curious by nature, and most young people rather, do not know how to take no for an answer. So the problem is, if they are denied these services, they are still going to indulge without really putting in place the necessary measures that are needed for them to stay safe. So the problem is, when these services are denied to young people, we will see young people indulging in sexual activities without really putting in place the precautions to stay safe. And the reason why we have a lot of issues to do with teen pregnancies. I come from Eastern Province in Zambia, by the way, the province which is always leading when it comes to teen pregnancies, which is very sad. And these are the outcomes of really denying services to young people who are sexually active, because the notion is children cannot be sexually active. A person who can be sexually active is a person who is an adult. That is the notion, but that is not the reality, because we have a lot of young people who are sexually active, and you know because of that nature, they want to indulge. And so if these services are really not given to them, we'll be having cases to do with teen pregnancies, the increase in spread of HIV, unsafe abortion, and quite a number of other harmful vices as a result of denying young people sexual reproductive health and rights services. Thank you.
Thank you so much, Foster. Indeed, young people that are sexually active, when they are denied these sexual productive health services, it has that effect on their lives and the decisions they intend to make. You mentioned about teen pregnancies, and some of the young people have resulted even in committing unsafe abortion, and others have even died while terminating those pregnancies. I think really understanding the impact of these laws to the young people would also be helpful. And Foster, you mentioned about how these laws and how young people need to understand these laws. Do you really think, from your experience, young people understand these laws, or is there a gap between the policy and the awareness? Foster, we can't hear you.
You cannot hear me? Can you hear me now?
Yes, now I can hear you. Yes, yes.
All right. So I was explaining that for someone to understand the laws or acts or policies or strategies that are in place, actually, I don't think we are doing good even as a continent or even as the SADC region, because for someone, just if you, even if you're walking around, even if you're chatting with someone, for them just start explaining about laws and policies, you would think that this person is a lawyer or something, or maybe they're already exposed to such kind of information, right? So the moment we develop our laws and the policies, I think they're stuck in bookshelves. They're gazetted, they're staying there. The people that only have a chance to go and use those laws, to understand those laws, interpret them, they're the lawyers, the judges, and the magistrates, or the people that are working in that field that are forced to know those laws. So I think governments and stakeholders have a very huge task at hand to make sure that people, even in the community, understand the laws that we have as countries. I'll give you an example to say we were implementing a project, Chinji, close to Eastern Province, close to Chipata. It was about ending child marriage and teenage pregnancies. Young girls didn't even know that getting married at a younger age, at 13, at 14, at 15, was illegal, right? They thought it was normal, it was their cultural practice, it was a way of life that the moment they clock 13, they're supposed to get married to someone because their parents forced them to. Of course, it's the issue of socio-economic aspects coming from a poor family, and also huge difference is the culture that most of the times they're getting married off at a younger age. So when you're telling them that if you're married at this age, it's illegal and the person is supposed to be persecuted, it was actually news to them, which is very surprising. You would assume that everybody knows, but no. So this is our task as civil servants, as young advocates, as youth advocates, as young people on the ground that are familiar to laws and policies, as governments, to make sure that the moment you develop laws, we make sure that they trickle down to the communities. Now they know and understand. How can we do that? We can interpret the laws into a common language that is widely spoken in our communities. We can put them in booklets, very summarized booklets that young people will be able to read and understand them. We can unpack the laws and the policies during radio shows. We know radio is widely listened medium. It reaches everywhere. We can be listen, we can be utilizing platforms like this where we know young people will be joining, they'll be listening just to unpack laws and policies that affect their needs and well-being. So to answer your question, yes, we have laws, but I don't think a lot of young people are aware to say what is age of consent. There's supposed to be a minimum age where one is supposed to go and access SRH services. There's supposed to be an age where one is supposed to get married. So yeah, thank you so much.
Thank you so much, Foster. I love the fact that you mentioned to say we are not doing well when it comes to sensitizing or rather educating our young people when these policies are put in place. And you mentioned one of the most effective way that we can reach to our young people, and that is social media platforms, because that's where most young people are found these days. And if we can use social media effectively, I think a lot of young people would be reached with this information. You mentioned about a platform like this one on the Real Talk Show. I guess we are giving out the information, and I think welcome to the show. What do you have to say with regards to what Foster mentioned about young people not having the information?
Brand, was that for me or it was for the other brand? Sorry, I didn't get you. My network is kind of tripping right here. Was it for
Margaret,
me?
are you there?
Okay, I bet that was for me. Thank you so much. I know It's surprising to see me on the show despite not being on the poster. We had some technical challenges, so I thought it would be nice and it would be okay for me to jump in. I don't even know how the conversation is moving at the moment, and I'm not even sure of where you guys have reached, but I have at least gotten something from what Foster is just from saying. It's very sad to know and to hear that we have a number of young people are getting married at a very tender age, and it just seems like it's a normal thing wherever they are. Like when they reach a certain stage, they just have to get married. But then another thing that we need to look into is the fact that we have some young people who are in areas where they can't really access services, like not really services. Young people cannot access, let's say, social media. These are young people. Let's say you've spoken about a young person who is 15 years old, or 14 years old, and then this young person is married. But then they have no access to a smartphone, they have no access to internet where they can learn certain things and where they can just get certain information. And even the age of consent itself, some people don't even know that there are laws that are there to just prevent them from getting married at a tender age, or laws that can actually guide them when they want to access certain services. We don't really get to They don't get to have that kind of information. So for me, I would still get back to Foster, since you are the one who brought it up, to say there are some areas where young people are married off at the tender age, but then at the end of the day, you're going to find that there are certain mediums that we can use to just try and reach out to them. So as a young person who saw something like that, and as a stakeholder, what um what happens when you find yourself in such a situation, especially finding yourself in situations where young people um are not able to access these gadgets that can help them at the end of the day? What do you do, Foster?
That was back to me. All right. So um, I'd say in communities we have existing structures, right? I will speak from a Malawian perspective. Let's say you're married at a very young age, and normally in communities we have, as I said, community structures. So at a TA level, we have area development committee that are working at TA level, traditional authority level. Aside from that, we also have what is called village development committees. Aside from that, we also have victim support units and social welfare people from the Ministry of Gender that are moving around in the communities. These people, their task, the very first task, is to ensure that they're protecting and promoting the rights of a child, of young people. That's the first thing. So these structures, they're already in the communities because they're there for development, for social development, right? These are the very first people that you're supposed to reach out to as a young person. You don't have gadgets, yes. You don't have smartphones. You're living in a very rural area, a typical rural area where even radios are very scarce to find, and you're in that situation, what you can do is you reach out to these existing structures. They know what to do. The social protection workers, they are there in the communities moving around. The victim support units, those structures, they were created and existed to ensure that they're protecting the rights of a child. At the moment, also police is being empowered to ensure that they're also protecting children. The victim support units, the police, these are people that are there to ensure that this is happening. We also have traditional leaders that at the moment they're being held to account to ensure that they don't sign off to say we are marrying off this child. They're supposed to be the guardians, the protectors of the whole community to ensure that this is not supposed to be happening. So they are there in the forefront to ensure so that this is not happening. I mean, we can go on and on. Even themselves, young people, they have youth structures, youth networks, youth clubs, youth led organizations that are working in our communities. We can reach out to them to ensure that um, we are getting enough information, and also they're rescuing other young people from such kind of vices. Thank you.
Thank you so
Great.
much
Thank you so
for
much, Foster. I love the fact that you,
Brian. You can go ahead.
yes, yes, Foster. So you mentioned about young people using the already existing community structures, which is, I think, one of the most effective ways, because then the community also takes a sense of ownership, and if this the community takes ownership, that also speaks to sustainability, because they will then know that this is our responsibility. And this draws me to a question about these laws, the age of consent laws. So, from you, Brian, I would love to find out, do these laws, the age of consent laws, affect young people's ability to access services like usually go to access at these health facilities?
Thank you very much, Brian. Uh, of course, the age of consent laws do affect young people. And what we need to understand is the whole purpose why age of consent laws were put in place to begin with. It's because the people at that time felt young people lack the maturity to make informed and reasonable decisions concerning, their health, themselves, and things like that. And that's why age of consent laws are put in place. The problem comes in when you have different definitions of who a child is. In the context of Zambia, you go to the penal code, you find out that a child is basically someone who has attained the age of 16 or below. But then when you look at the Children's Code Act, it defines a child as someone who has attained the age of 18. And so just from there, the laws are meant to put a limit on what children can do or access to, because it is perceived that they lack a certain level of maturity to make informed decision. Now the problem comes in where young people now are really exposed to things that were at a certain point in history considered something that a young person cannot really be interested in, cannot really fall for. That's where the problem comes in. And why we are talking about the age of consent today, it's because the world has evolved. Yeah, the level of maturity that a person would attain back in the days is different from the age at which a person can be called mature. Back in the days, and I actually talk about this every time when I'm in such spaces. When I was in grade 8, some years back, we would have parents in school. Is a little bit poor.
Yes, yes, we can hear you.
Perfect. Yes. So as I was saying, when I was in grade 8, we had people who were, parents, yeah, coming from home to school, leaving their children and whatnot. But today the reality is different. You can have someone who is maybe 16 years old, 17 years old. They're already done with their high school. They're going to university. They're going to college. That shows the how quick it is for a person to mature these days. So now the problem is, the reality is that young people are evolving. They're becoming more mature at a very tender age. Meanwhile, we still have the same laws that were being used generations ago to govern a different breed of young people. That's where the problem comes in. And so now, because of that, because young people are exposed early, because young people mature early, they now become sexually active. They want services to do with their sexuality and reproductive health. But then the laws that are in place are laws that were meant for the generation of people at that time. And so these days, you find a lot of people who are sexually active, want to have their services and stuff, but then they are limited because of these laws that have been put in place. Like I said, I come from Eastern Province. There are a lot of cases to do with teen pregnancies, a lot of cases to do with early marriages, and you would find someone as young as 13 getting pregnant, someone as young as 14 getting pregnant. And the reason it's because there are all these laws that have been put in place that are really restricting young people from accessing the services that they are supposed to access. And you know, most of the times when we're in such spaces, we put the blame on the service providers. The nurses do not give services. You know, the people found that facilities do not give services, and that may be true, but then these people are actually just following the laws that have already been put in place, because at the end of the day, we might have policies, but when it comes to legal issues, the hierarchy of legalities, the law is, you know, more superior to policies. And so what we need to do is really work on the policies that exist, because if we do not work on the laws, we may have good policies, but those policies will not be implemented. So as it stands, the law is really making it hard for young people to access these services. Thank you.
Thank you so much, Brian. That was really a good explanation. I have gotten a lot of points from your explanation. You mentioned about how these laws restrict young people, how times have changed, how the world has evolved, and what may be an abomination back then may be a normal thing today. If we look at how these young people, you mentioned about Chipata and how young people are getting pregnant and also having these young people that are sexually active. I mean, it is only fair that we provide these services to them despite their age. Because look, young people do not ask for permission to go and have sex, but why should they ask permission to access health services? Let's say, for example, contraceptives. Why should they ask their parents for to get contraceptives when they do not actually ask their parents to have sex? So really, these are the questions that we need to ask ourselves with regards to whether the age of consent and these laws really help us or bring more harm to our young people. And coming to that, I would also love to find out from you, Foster, what are some of the real life consequences with limited access to these health services, especially to the young people? It could be in your community, in your country. What are these other impacts? Brian mentioned about teen pregnancies. What are other impacts that these laws are causing in our communities?
That's a very good question. We cannot deny times have evolved where young people are now getting sexually active at a very young age comparing to old times. You can find out that someone like a young girl, literally a child, is menstruating at at 10 years, is menstruating at 11 years, even at 9 years, a young girl is menstruating. So times have changed. We can actually acknowledge that. And by the time they're 13, 14, 15, they've explored. They're adolescents. They've explored. A lot of things are happening. Here in Malawi, we had a case where an 11-year-old was pregnant, which is surprising. It was an alarming thing to say, look at this. This is our reality. That means this thing is happening. So the consequences of having such kind of punitive laws in place is that, firstly, Brian pointed out the teenage pregnancies. They are there. It's not like young people not having sex. They are having sex. They're having sex because of peer pressure. They're having sex because they're coming from a very poor background and they want some financial gains. This is happening because their body is telling them to. So a lot of things that are involved, a lot of things that are happening. Uh, but then teenage pregnancy is happening because of that. Aside from that, we have these things in place because young people cannot go and access the services when they want them. They cannot go and access contraceptives. They cannot go and access condoms. So they end up just going there straight, having the sex raw. In the result, they're having teenage pregnancies. Aside from that, in our communities. I'm not talking about urban Lusaka or I'm not talking about Chipata, Livingstone. They are more advanced. I'm talking about somewhere rural, somewhere very typical rural, where it's very hard for them even to have proper electricity throughout the whole week. But what I'm trying to say is these young people, once they get pregnant, what their parents are doing is that they marry them off. They marry them off at that young age to say, you have disgraced us. You went out there, you have gotten pregnant. What we're going to do with you, go marriage, because you feel like you're old enough, just go. So that in itself, it's also causing child marriages, which is also on the rise at the same time because of the same pregnancy. So also adding on top of that, once a child is impregnated at a very young age or at an age where they're not fit to conceive or give birth, they end up in a lot of complications, right? There's abortion, post-abortal complications. A lot of things are happening that these young people that they are facing. In the end, you end up losing that child, contributing to rising in maternal deaths, which is something that at the particular time we're supposed to be avoiding. No woman is supposed to be passing because of pregnancy. Now that's just odd times. We're supposed to be moving forward. So just because these young people, because of the laws that we have in place, they've gone out there, they've gotten pregnant, they end up that maybe they want to abort and self-abortion, they may end up dying. Or even when they were they were giving birth, they didn't manage to give birth properly. They end up facing complications. So we're actually putting the lives of the young girls and teenagers on the risk when it comes to this. Also, a major contributing factor is we're actually contributing, we're rising the poverty in our countries if we're allowing young people to be giving birth at a young age. So look at this scenario where at the way we are moving with our economies, we are relying on external donors to be funding our national budgets and everything. But a young person, they are giving birth every day, teenage pregnancies, because they've been denied to go and access SRH services. What happens is they're giving birth to one another. At the end, government, instead of just spending maybe $1 or maybe $5 on a person, uh, they end up increasing the money that are supposed to be spending on people. In such in itself, if the population is increasing, that means the pressure is getting on the resources. In this way, government each and every year has to adjust their monies. They'll keep on borrowing. In that way, we're just contributing to a lot of inflation and stable economy. In itself, teenage pregnancy is also an economic issue. Well, as the way I've explained it is that it keeps on pressure on government resources. So if we give young people to say we remove completely the age of consent, to just say anyone who's sexually active can go and access these services. We are going to avoid teenage pregnancies. We're going to avoid child marriages. We're going to avoid rising post-abortal complications. We're going to avoid maternal deaths amongst the young people. So those are some of the dangers that if we keep on having these age of consent laws in place that we're most likely going to face.
Much. Thank you so much for that good explanation. You mentioned a lot of these challenges that young people may face as a result of not accessing these health services. And the real question now is we have known the problem. What can be done? Margaret, is there anything that would want to ask our guest with regards to what can be done? Uh, uh, we've seen how these age of consent laws have affected, or rather affecting young people or hindering young people to accessing health services.
All right. So before Margaret comes in, perhaps I can
Margaret,
just
are you there?
Is it okay if I just make a comment concerning the question that you're just from asking, Brian?
Yes, yes, yes. Please go ahead.
Do we still have Foster on the call? Or we've lost both Foster and
Yes, Brian, you can go ahead.
Okay. Uh, yes, so I just wanted to make a comment concerning the age of consent. Personally, I don't really see it to be a bad thing. I just feel we need to, it's something that needs to be tabled again, and then we review it. Because the reason why I talk about why I mentioned that, and this is something that we mostly talk about, and it really gives me concern personally, because when you look at the age of consent and all that, like I said, it's meant to put a certain restriction on what young people can do. But also, if you look at the other side of the age of consent, it's also meant to protect young people. The reason why we talk of things to do with defilement, it's because of the age of consent. And when you look at the laws that speak to defilement, they actually state that if a person is not of age, whether they give you consent or not, it will still be, regarded as defilement, because at that level a person has not maybe grown to that level where they can make a decision from a mature point of view. And that's the good side of having laws that have to restrict the age of consent. So for me, I don't really feel like completely removing the age of consent, but perhaps we can just table it again and see how best we can evaluate this law, and make it favorable for every other person. And speaking to defilement, uh, that's actually an interesting thing, because if you look at the age of consent, the age of consent is 16 in the case of Zambia. So, should we decide to lower it, then the question comes in to say, does that mean that the age at which defilement is regarded as defilement will be reduced as well, or does it remain at 16? You understand why this conversation is very complex, because these are some of the conversations that we need to be having as well as civil society organizations. It's not just a matter of advocating for the reduction of, in terms of the age of consent, but also these other factors, the benefits that come with the age of consent, how young people have been protected from abuse, from harassment, what happens to that portion that comes about as a result of the age of consent. So for me personally, I feel the age of consent is actually a good thing, but then we just need to find a way of making it favorable for young people. In a case where we say, okay, young people can now give consent uh, from whatever age, if they find themselves in a situation where they are defiled, as we call it now, according to the age of consent, will it still be regarded as defilement? And these are some of the things that we need to to put into consideration. And lastly, we need to harmonize laws. Like I said, the constitution defines a child as a person who has attained the age of 18 or is below. The penal code talks about 16. These are some of the issues that makes this conversation very, very hard. Thank you. I don't know if you were able to hear me.
We were able to hear you, Brian. So, from what you have been explaining, Foster, do you have anything to say, to add on from what Brian wants have given us?
Yeah, no, I'm agreeing with his sentiments to say, no, that is true. I think the first thing that the world agreed, the UN will have the UN Children Charter in place, and all the other international laws, regional laws, or country laws. The first thing that they prioritize is protecting and promoting the children's rights. So we protect them from sexual exploitation, we protect them from sexual abuse, we protect them from child labor, we protect them from a lot of things. So the first thing, that's what they do, that's what they look at, right? So I agree with him to say the first thing is to review our laws and to make sure that, in as much as we want to put in place laws or clauses that favor young people to go and access SRH services, but we also have to look at the interest of a child when it comes to protecting them, when it comes to abuse, when it comes to exploitation, when it comes to child labor, and all the other associated harms. So I agree with harmonization of laws, making sure we're critically looking at our laws. The next thing is implementation. We might have these laws in place, beautiful laws, well structured, well written, but what happens is enforcement on the ground. It's very weak. It's supposed to be starting from in our communities, supposed to be gatekeepers. We're supposed to, the chiefs that we have, the structures that we have. If you can bribe them with just a chicken, with money, you walk away. If you have raped a child, you move to somewhere else. Teachers that have raped students, very young students, what they do, what do they do? They just move them from this school, they transfer them to another school. They're still the same people that's still going to do the same thing. There's the other school that they're being transferred to. So I think we're supposed to be when we are they're implementing these laws. Same thing goes to the police. They have a very huge task to do. You might see that someone has they have raped someone, they have gotten them, they are arrested. Next 2 weeks, the person is scot free. They're walking on the road and you ask what is happening. Yet this person raped this child. Yet this person, they beat the child or they beat their wives and whatnot. So I feel like implementation is also a very huge issue that we lack, most of us. We might have the laws revised, we might have the policies in place, but implementation is also something that's minimal. Another issue that I see it more common now, and it will affect us as African countries if we don't wake up. Is the issue of financing. Most of health-related programs, or most of sexual reproductive health and rights programs, or child promotion and protection, or youth empowerment programs, we are leaving them to donors. We have been relying on donors. If you look at our national budgets, we can see, yes, our national budgets maybe they talk about maybe okay, yeah, the budget declaration talks about every nation supposed to allocate 15% of their national budget towards health. But you can see that each and every year maybe 8% is going towards health, 9% is going towards health. The other chunk, where is it coming from? Coming from donors. Surprising part is that the the USAID has cut funding. The UK aid has cut funding. They've reduced their funding. So what are we supposed to do now? Us, our government, we need to look domestically where are we going to tap resources, and we're supposed to increase our budgets towards these health-related programs, child protection programs, youth empowerment programs. So that's where also the next direction that our government is supposed to look at to say, let's raise more resources, let's raise more funds and channel them towards these programs. I think that's what I can also say, adding from what Brian said. Thank you.
Thank you so much, Foster. And I agree with you. I think also it goes to after we formulate these policies, it is also important that we look at our financial structures, our health systems, how are they funded, and we begin to ask ourselves due to time, I would also ask you guys, Foster, to our viewers, that have followed us. I see their comments, they are following, and what are your last, or rather your last message to our viewers? I will start with you, Foster. Then we'll go to Brian.
All right. Thank you so much. I think it was very nice to be on this platform and discuss issues that are affecting us as young people. I think age of consent is very, very important. And the first thing, you need to harmonize it. You need to have it uniform across the board, harmonize our laws, ensure that our implementation is happening, funding is going towards these programs, and throughout the whole process, let's involve young people, meaningful youth participation. Let's involve young people whenever we're doing all these things. They need to have a say, they need to have a place on the table. We just don't want to invite us to meetings and you tick your boxes. No, let's go to the spaces, let's go on the platforms and we contribute meaningfully to the discussions and they take our solutions and implement them. Thank you.
Uh, thank you so much, Foster. And to you, Brian, what are your last words to our viewers that have followed through this conversation?
Thank you very much. So, to the viewers, I think we need to take interest in learning more about the age of consent and what really it comes with. Like I said in my previous statement, that we need to look at the positive part of the age of consent, and then we also identify the gaps. And then the gaps that we identify, we need to find ways on how we can actually work on them to actually improve those gaps so that we can have better services to the young people and to the young people themselves who may be sexually active and whatnot. My piece of advice to you is do not just be excited about receiving services, about accessing services. You also need to be responsible young people as well.
Mhm,
I always talk about the
mhm,
responsibility that young people need to have. It's not just about having rights for something, it's also about having the maturity enough to also consider and accept the responsibilities that you need to take as young people. So thank you very much, Brian, and to the entire TYP for having me on the program. It was exciting to be here. Thank you.
mhm, mhm. Thank you so much. The pleasure is ours. And thank you so much, Foster, as well as Brian, for joining us. Uh, thank you so much for joining us. We will indeed call upon you next time just to drive this conversation further. I was your host today. My name is Mone Brian, and my sign language interpreter was Shadrach, or is Shadrach Chansa. See you next week, same time, for another exciting episode. Thank you so much. Indeed, if you have any other questions, concerns, please do drop them in our chat. We'll be able to respond to them. Thank you so much and see you next Friday.